The South African Medical Association trade union, with Cosatu's backing, marched from the union buildings to the National Treasury. The union wants government to intervene and address challenges facing health workers. These include the plight of unemployed medical doctors, staff shortages and the improvement of infrastructure and security at health facilities. Newzroom Afrika's Vuyolwethu Yamba filed this report.
The South African Medical Association trade union is calling on the National Treasury to redirect unspent funds. The union's president, Dr. Langanani Mbodi, says these funds should be addressing healthcare workers' shortages. Cosatu also joined in solidarity, marching from the union buildings to the National Treasury's office to submit a memorandum of demands. Thousands of doctors in the country are yet to be placed. As this crisis deepens, the Department of Health blames Treasury's austerity measures for the shortage.
There's no way that we'll have in a country that is riddled with diseases, and we have a lot of doctors who are unemployed and shortages in the clinics, yet we get told there's no money. It means that we have leadership that does not plan, and perhaps the West that does not care about its people. It does not make sense at all that we have more than 1,500 doctors unemployed, and yet you go to hospitals today and now, you'll find that there's no doctors, or there's only one doctor on call who's exhausted, who's making mistakes because of exhaustion, with long queues of people waiting for just one doctor.
Mbodi says South Africa needs to relook how the country prioritizes its healthcare system.
I think they need to go back to the drawing board and look into the ratio that we have. WHO says the acceptable ratio is like about 1:1,000, it will be acceptable. Right now we are beyond 1:3,000, which means that one doctor is looking after 3,000 patients. So they need to look about what they are doing. One, government had demanded that the training institutions, the university, must increase the number of doctors they produce a year. And they did that. They even sent people to Cuba to train so that they increase the number. That was a good move, and we thought that we have a government that has a vision.
Meanwhile, some doctors in Gauteng have expressed frustration over the high unemployment rate of qualified doctors. They are calling on the Treasury to intervene.
How do you have a bunch of doctors like this marching for employment or the lack thereof, it means that there's no provision of healthcare in the public sector.
The HOD of Health told us they are not obliged to employ all unemployed doctors. Their obligations are to the bursary holders, of which they have contractual agreements to.
Health Minister Dr. Aaron Motsoaledi said earlier in January that the government's hands were tied as the budget cuts squeezed services across the board. For Newzroom Afrika on Channel 405, I am Vuyolwethu Yamba in Pretoria.